Then I realized I failed that patient. I failed him because of my lack of knowledge, and I also failed him because I lacked confidence as a new grad. If you're a new grad and you find something on your assessment, even if you don't have the words, the technical terms to express yourself, just that feeling of knowing that something is wrong is enough. So when I was a new grad, I was in med surg and I had 5 patients. It was a particularly heavy assignment because one, I had an insulin drip. Two, I had a patient that was on PD, and I had 2 total care patients, and one of those total care patients had C. diff, and they were blowing out. The PD patient was a young guy. While I'm assessing my patients passing meds, I'm always chatting it up with them, always having good conversation. I always want you to feel comfortable when you're with me. And his dad was at the bedside too. His dad had been there all 4 days. He said he was not leaving his son's side. He was such a good dad. And he saw that I developed a rapport with his son, and he saw that I was providing great nursing care. He said that he was going to go home, take a shower, take a nap, and come back at shift change, which was at 7 o'clock. Mind you, this was around 10 o'clock now that he's saying that he was leaving. I was like, no problem, go rest and take care of yourself. After lunch, I come back and I'm chatting it up with my friend, right? My patient. And I found that he kept on saying yeah, and like a lot. He kept on searching for his words. Very different than how he was. Now, granted, he was still able to express himself. I could still understand him, but that's not how I met him. He was searching for words, and he was substituting the words with yeah, and like. I asked him, do you feel different? Do you feel like something's different about you? And he said, yeah. I said, okay. I did a set of vitals. I did an assessment on him, including an NIH scale. He did well, passed with flying colors. But I found that he was still saying and yeah a lot. Not because I'm a new grad. I was like, let me go speak to my charge nurse and get her take on it. I bring my charge nurse in the room. I tell her my assessment findings. I show her the vital signs, which was within his normal range. And I said to her, with speaking to him, I find that he is saying yeah, and like a lot, and he's searching for his words. She spoke to him. She told me he seems fine. But I said, but even he says that he feels a little different, but he can't explain what the difference is. Still feeling uneasy, I kept on with my shift. Got that gut feeling, something's wrong. I went to the NP. I explained my assessment findings. She went in there, she assessed him. She said he seems fine, and she had saw him that morning. And this was about her 3rd day in her rotation, and she said that he was fine. Nothing seemed abnormal about him from her perspective, and she knows the patient, right? She has an established history with him. This is just my 1st day with him. She's been with him 3 days. I wrote a note about it. So fast forward in my shift, I'm in his room and it's just bothering me. In addition to that, I found that he was taking a nap and he was just snoring like really loudly. And for him to be such a petite guy, I couldn't imagine why he would be snoring like that. But he did arouse when I stimulated him. Went to the doctor. The NP was in the room and she just kind of like side-eyed me because she's like, we already spoke about this. But I spoke to the doctor too about it. He brushed me off. I went back and I went to the doctor and I said, okay, I just want you to know that I feel really uncomfortable because my patient has changed and no one's taken me seriously. Yes, his vital signs are fine. Yes, his assessment is fine. Yes, his NIH assessment scale came back normal. But I'm telling you, there's something different because I've been talking to him all morning and he's now more lethargic, even though he's easily stimulated. He is answering questions appropriately. He's saying yeah, and like a lot, and he's searching for his words. But I wasn't saying it like this. I was saying it all nervous and coward-like. Because I pressed him, and because I put a note in the chart in which the NP must have seen it, they went ahead and they ordered a CT. And I remember the NP saying something snarky to me, but I didn't know what to do. I just wanted to fight for my guy. Right as shift changed, CT came and took him down. The good thing is that the night shift nurse that I was given report to, she had him the night before, so she was familiar with him. I told her what I found, what I thought, and I gave her my number to text me to let me know the results of the CT. The CT came back fine. Fast forward in her shift, she said, wait, he is sleeping really hard and he's snoring really loud. And now when it's taken her a bit to wake him up, like she asked him, where are we? And he said pillow, just answering the questions inappropriately. She called the on-call doctor and he ordered a stat MRI. The MRI showed that he had a stroke. This is why, new grads, I want you to know that even if you're not sure, even if you can't flesh it out, you have resources available to you, and fight for your patients. If you're wrong, you're wrong. Who cares? But guess what? Your patient is going to respect you, and even your coworkers are going to respect you that, hey, you know what? Even though she was wrong, she did her due diligence. So the next day when I went to work, the rapid nurse came by and she was like, oh, are you so and so, and do you have room so and so? And I was like, yeah. And she's like, oh, well, it came across her desk that we had, I think the term she used was like a fallout or a miss in a core measure, and one of the core measures for that year was stroke. And then I told her the backstory and she was like, yeah, but that you should have called a rapid because we could have came and assessed the patient. I was like, oh, well, I didn't know, but I told my charge nurse and I told my NP, and no one suggested that you came. And she's like, yeah, but you should have known. Granted, I'm a nurse all of 5 months at this point, but I should have known this. And yeah, I guess I should have known. I'll take the hit. So now in my nursing career, this is why I'm so aggressive. This is why I go up the chain of command with no fear. When there's a fallout, it ultimately falls back on me. And I'm not afraid of that responsibility, but I do take that responsibility very seriously. And I want you to do that too.